Welcome to week 7 of this course on ACL injury rehabilitation. We are discussing return to sport and sport-specific conditioning in this week. Lecture 34, Monitoring Training Load, Fatigue and Injury Risk in Athletes. I am Dr. Jarin Shaji from the Department of Sports Medicine, AFMC, Pune. In this lecture, we will be seeing how to ensure optimal tissue loading. By the end of this session, you will be able to understand the importance of load monitoring in ACL reconstruction rehabilitation, the difference between internal and external load measures, the various fatigue monitoring tools and red flag signs, various technology-based solutions such as wearables and AI tracking, also various injury risk prediction models. Let's go ahead. The importance of load monitoring in ACL return. Why is it important to monitor the load? Because overload or excessive loading of the healing tissues can result in increased risk of re-injuries, and underloading can lead to poor performance capacity or insufficient progress. Various studies have shown that ACL injuries have a high re-tear or re-injury rate, which is almost 20 to 30% in young athletes. This is very high and can be prevented. So the goals of load monitoring are to optimize tissue adaptations, balance training stress versus the recovery, and to improve return to play decision making. The key principle here is that the rehabilitation is not just physical but also includes psychological and cognitive aspects as well. Let's see the various internal and external load measures. The external load is what the athlete does. It can be measured using various parameters such as global positioning system sensors, which measure distance, velocity, accelerations and decelerations during a session. Accelerometry. This can count the number of steps, jumps and impact forces. Force plates. These can detect asymmetries in landing or takeoff. The internal load is how the athlete responds to the external load. It can be measured using various tools such as HRV or heart rate variability. This is the beat to beat variability of the heart rate with a slight difference between each beat when the heart contracts. It is a marker of your autonomic nervous system recovery. Also, the session RPE or the rating of perceived exertion can be calculated as discussed earlier using the average RPE of the session into the duration of the session in minutes. This can be used as the athlete's perception of intensity of the session. Also, various biomarkers such as cortisol and creatine kinase levels can be utilized for measuring the internal load. Tracking both the internal as well as the external loads are very important, and a mismatch between these can lead to injuries or re-injuries. Let's see various fatigue monitoring tools or indicators and red flags. The fatigue indicators are decline in movement quality, delayed reaction or loss of coordination, decreased heart rate variability, increased resting heart rate, and persistent soreness following the training or rehabilitation session. The various red flags in ACL rehabilitation are knee swelling or pain after the sessions, loss of range of motion, or inability to complete the training volume without any compensatory movement patterns. Also, the athlete or individual may have psychological hesitation such as fear of movement and measured low ACL return to sport after injury scale scores. These do indicate that the fatigue or is more and recovery is insufficient. Hence, the training load has to be customized accordingly. Various technology-based solutions can be utilized for training load monitoring and fatigue monitoring. These are devices such as wearables or fitness trackers using GPS units, accelerometers, gyroscopes, and inertial measurement units. Force plates. These can be utilized for jump profiling and can detect any asymmetries in the jumping or landing patterns. Also, smartphone based motion capture integrating artificial intelligence can be utilized for identifying various movement patterns and compensatory patterns. The emerging trend is that personalized rehabilitation dashboards integrating all these biomechanical, physiological, and psychological aspects can be utilized for getting a holistic monitoring solution for the athlete. Now coming to injury risk prediction models. These utilize a multifactorial approach with strength, movement quality, training load, and psychological readiness. The common models or tools used are the ACLR Return to Sport Index, the load injury relationship models, which are U-shaped curves with increasing load, the injury risk may increase, and with reduced load, again the re-injury risk may increase. Therefore, underload as well as overload increases the risk of re-injury. Various machine learning models can be utilized to predict injury likelihood. The limitation of these models are that no single model perfectly can predict injury risk. So always a clinical interpretation is needed to correlate between all the parameters and findings. Coming to an applied case study. A 20-year-old basketball player, 8 months post ACLR rehabilitation, is entering late rehab phase. So the monitoring plans for him or her could be GPS tracking for high speed running and accelerations, HRV for each session or daily morning assessment of recovery, weekly jump asymmetry testing on force plates, and daily rating of perceived exertion tracking of the sessions. The findings could be: in week 2 he may have increased high speed running and decreased heart rate variability and increased swelling after practice. So based on this, the load can be reduced and recovery can be added. Whereas in week 4, with balanced internal and external loads, stable heart rate variability, and improved movement quality, the load or the training schedule can be further progressed to sport specific drills. These are my references. Thank you very much and have a great day. Jai Hind.